Well, today's talk is about, or my talk at least, is about the environment and the role on children's health. Just a brief word about myself. I'm appointed at Fontys University of Applied Science and also Maastricht University, both in the Netherlands. And I'm head of a master's program in sports and physical education and leader of a research track on physical activity in and around schools. Well, to present, actually, this is my little best in town, okay? Just to give you an expression, it's not only science I'm working with, this is my practice. So, and actually this is the most important message in this presentation. Every child deserves a healthy start in life. Regardless where you're born, your socio-economic status or whatever, this is what drives us and is more an ideology. But beyond ideology, it's also about scientific evidence. We know that children's lifestyle behaviors are mostly formed during childhood and they track into adulthood. We see that patterns in physical activity, we see that patterns in nutrition behavior. If you start early with a healthy lifestyle, the chances are way much higher that you proceed in adulthood with those healthy lifestyles. The other way around is true as well. If you're, well, at least start unhealthy, the chances of getting healthy is quite difficult. Although, well, you might already know that or be aware that I talk about healthy lifestyles. Later on, I will actually talk about energy balance related behaviors. So they both contain fruit, vegetables, and physical activity, as they are quite strongly correlated in children's life. But it's also about exposure. Exposure of different settings. Children are exposed throughout the day to different settings. For instance, a home environment, a school environment, well, sometimes a medical environment, but hopefully not as much. And particularly those environments and settings are really important for health promotion. As well, we can do beautiful things in science, but as no one is aware of it, and we are not able to present the results to the people that actually need it in, well, settings they are actually in, we're not going to convince them or to reach them. So it's really important to understand where they are exposed to. And, well, environmental exposure is therefore very important. And just in a few moments, I will give you a sign in a moment. Oh, it's already started, then I'll guide you through it. Well, you see time is running below, and the dots are actually children. Well, dots are from white to red, and if they are red, children are more active. White means sedentary behavior. And you see throughout the day, children are exposed to actually a limited number of environments. On the right hand is the primary school, on the left hand is actually the sports environment. Well, they're just going over there all the time. Well, this runs up to 3 o'clock. Well, now they have an afternoon recess. You see they are quite active over there, but very sedentary during the school day. And after 3 o'clock, you will see they go home and just enter several settings. But definitely not all the settings we expected them to be in. Well, just follow them wherever they are. Well, on the right hand, you see a beautiful green space that's accessible, easily accessible actually, but no one is going there. Why? What is it? What can we learn from this environmental exposure? And we see now someone up in the upper part on a sports field, but actually those are the most visited settings in this case. Well, and that child, the animation runs up to 9:30 and then we stopped it. So it was actually done by children, and we put on a GPS and an accelerometer and combined both information sources and presented it on a map. So actually this is how we do it. But we see to what environments children are actually exposed. And particularly in those environments, we can find them to intervene and well, come up with health promotion activities. And therefore, I would like to introduce the environmental research framework for weight gain prevention, the energy framework. We use it for our research work, and particularly I want to focus on the environmental part. And well, I'm now going to talk about the lower half actually of this framework. This represents a dual process view in which we can go, well, via a mediating way, but also via a direct way of the environment on energy balance related behaviors. But it's also important to notice the moderating factors in there, which actually means that the relation between the environment and health outcomes of energy balance related behaviors is not the same for everyone. There is no one-size-fits-all environment to affect every child in the same way. It depends on gender, it depends on your socioeconomic status, it depends on way other variables. So take into account to optimize environments for a particularly important vulnerable group if you redesign it, of course. So it's about balancing between physical environments, the built environment around us, social environments, economic environments, and political environments with regulations and policies. I will come to that. And, well, we see a huge change in society. Well, it's expected that around 2040, 60 to 70% of our population is living in cities, which is actually considered as a health threat. However, it can also be considered as a major chance by all those people are actually clustered and we can easily reach them by exposure. So just put it the other way around and take it as a chance. But of course, in an equation, if we do not know what is effective, we can have a huge reach, but we will still not have an impact. So it's really important to understand what is effective. So for this presentation, I went into well, the evidence for fruit and vegetable intake. And actually, there is not that much effective right now. Well, it's quite hard to see, but well, there are some little evidences. Well, one I found was at least that fast food density is related to a higher BMI. Well, this is Lyon. So, well, yesterday dinner was very good. I guess it's better than this, and this is only one company, so I couldn't put in the same map for all the others. But, well, on the right hand, you see a picture of Amsterdam. They're all food, well, fast food density of outlets right next to each other. Moreover, the other way around is true as well. If you're exposed to higher food, of healthy food outlets, health and nutrition increases as well. So actually, there is a strong relation. Well, in a meta-analysis by Lee and colleagues, we also saw that availability of fruit and vegetables is actually the strongest predictor of fruit and vegetable intakes in children. They need to be available in home. Well, it's quite obvious, but still needs to be done. And one of those initiatives actually that target or reach out to support availability is the EU program on school fruit. Another meta-analysis, also including policies, showed that direct provision is the most effective intervention currently going on for fruit and vegetable intake. However, still these outcomes are quite limited and effectiveness is quite low. So we need to improve a lot. And therefore we can change environments. As well, we all have quite strong habits. Yesterday we heard it as well. Why do we something? Well, actually we don't know all the time. We're just doing it because we are used to do it. And changing environments is very effective in breaking humans' habits. So either you should have very small reachable goals, then you can change habits, or you should drastically change the environment and you will have to reset your natural behavior and you form new habits. In this case, we can affect that fruit and vegetable intake in children. So that's really important to think of how we break those habits. As I was mentioning, it's about interacting between the 4 types of environments. It's not only being there is enough. Well, of course, availability is important, but we also have to support the right, or at least the desired health behavior. Support either in a social way or in an economic way, but also on a policy level. If you provide people with a healthy opportunity, but there are regulations that inhibit the behavior, we will not find any result. So it's really about aligning environments and interacting between those. So I came up with this very broad sentence. It's the environment is an outcome of an interplay between all types of environments across multiple settings on different levels. So it becomes quite complicated, as it actually is in creating a healthy environment. But more important, we're all part of the broader system a child is living in. So we are all connecting. We are all connected from a health perspective, from a medical perspective, schools, GPs, neighborhoods, homes, parents, the children themselves. We're all a connector. And as you might know how these connectors work, they influence each other, but sometimes they block. So we have to be very careful how to put in the connectors and at least work together. And I therefore strongly advocate to have multidisciplinary teams to work on healthy environments and not think of single disciplines focusing on a particular behavior. Although the ideas are beautiful, we need each other actually in this. Well, we also studied this in a couple of papers. Well, actually, we looked at school settings and home settings. Actually, the school setting was also childcare. And we see that if we interact between physical, social, political, and economic environments, we have better results on children's energy balance-related behaviors. Those outcomes are actually even better if we align the environments and the messages both in school and home settings. So alignment across settings is very important in this. I could also easily put in healthcare settings or urban settings in here. It goes for every setting. It's about the interaction between types of environment and alignment with other settings. So those interaction between types of environments show synergetic outcomes in children's energy balance-related behaviors. We saw this in a couple of studies we already did, and well, we found some evidence that we can affect children's nutrition behavior and physical activity either by changing the physical environment, either by changing the social environment, but in those environments we interact, those types of environments, we see synergetic effects. Well, this is actually the same as Professor Riboli told us yesterday with the smoking example on mortality. Well, smoking itself, of course, it was harmful, but it became more harmful when other unhealthy behaviors take in place. There was a synergetic effect on mortality rates, and here we see exactly the same, but just in a positive way. We need to align and to interact just, well, to increase our potential. But how? That's, of course, a quite difficult and interesting question. And therefore, I would like to propose a top-down, bottom-up approach, which we have successfully applied in the Netherlands in a couple of school-based programs yet. And it's about creating an optimal fit between what actually we think as scientists and policymakers, what should be done. Well, it's always, I guess, difficult to think what others should do, but actually also take into account what are their needs, what do they want, and how can we optimally fit those needs. Just see whether it's okay. And therefore we actually try to model this, and well, the basic idea is creating a supportive environment, which is actually in the middle. Well, ground idea in this is either you could improve the physical environment, or you could support the social environment. So either you will reduce the slope of the hill, or you will put in some more social efforts, well, people that are supporting the guy who's trying to push up the ball up to the hill, as we try to do this in the least, well, in a way that causes the least effort. Actually making the healthy choice the easy one. So for the synergetic effect, it's also, well, if you lower the hill and you put in a lot of people that help you support, well, it becomes, of course, way more easy to get the ball on top of the hill. Well, and in this we see an interaction ongoing between, well, we call it the top-down approach. We as policymakers, health practitioners, health promoters, scientists, we provide, well, sometimes agenda setting, but also evidence-based practice. What do we know? What can be done? But we particularly need to take into account needs that are provided by end users. What do they want? And their societal needs may completely differ from what we think that are societal needs. Just from another point of view taken. And these interactions goes on. So actually I was asked from science to practice. So, well, I did some homework for you. Well, actually, I thought most of you were in a medical setting working, so I entered some waiting rooms. Well, they're very nicely designed, but I missed any expression or exposure of health. It's a health care setting, I know, but I missed it. So actually, I made it quite easy. I put it in for you. So it's not that difficult. It's just about a physical expression of healthy behaviors by exposing them to a certain behavior. It's not that they need to eat that fruit over there, but it's always about exposure to certain ideas. Another example, again, well, looks quite similar. I put in a poster. By the way, my talents with working with Photoshop are not that good, as you might see, but well, the idea is taken, I guess. So it's about health and nutrition and the role of a family. It can be fun. It's exposure on the social aspect of health and nutrition. And well, a final example. Well, I guess these waiting rooms will look the same in France, for instance. Lots of glossies and journals with private lives of famous people, but put in some healthy themes. Why are all those glossies over there? Well, we can put in and easily expose people to the message we want to receive them. So, to wrap up, well, one, urbanization is a major chance for creating sufficient impact by fruit and vegetable and other lifestyle interventions. Creating a health supportive environment contains changes in multiple types of environment and ideally are tailored to the needs of vulnerable populations. Environments in which healthy alternatives take less effort than current unhealthy patterns are most likely to be successful in changing a lifestyle behavior. Health supportive environments should be co-designed by end users to become effective. We should not do that by ourselves. And focus on the broader system in which children operate. Children are exposed to multiple settings throughout the day, and integrated programs are needed, such as providing, for instance, healthy alternatives in the physical environment in combination with a supportive social environment by role modeling by parents or GPs. Well, thank you for your attention.
Thank you for a very stimulating lecture and impulse. Questions? Margarita Caroli.
Margherita Caroli, European Childhood Obesity Group. It's a very fascinating presentation, but I'm wondering how we could get success with such an exposure of negative factors. We are doctors, and we have a sick mind, for sure. We speak about health, while the other part is speaking about happiness joy, taste, and all pleasant side of effect of that life. So, as long as we talk among us, that's fine. If we speak about healthy lifestyle or healthy nutrition. But when we speak to children or to mothers, we should forget health. They don't care of health. Children don't have in their mind the meaning of health. And as a pediatrician, if I find a child who is worried about his health, I'm worried for his mental health. So, shouldn't we speak about good nutrition, in which good means both healthy and taste, pleasant environment, happy environment, exactly like McDonald's does. Happy meals.
Yeah.
They're successful, and we're not. What's your opinion?
Well, thank you for this beautiful question. I really agree with you. I think we should not focus that much on health. Actually, health has a kind of, well, people see it in a way what we don't, well, actually, we're not allowed to do. We don't need to drink that much sugar sweetened beverages. We should, well, that's the other way around, we should eat fruit and vegetables. But make it more fun, make it easy, make it, health may be a second outcome. Or for us, it may be the first outcome, but not for them. Consequences for them for not eating healthy, well, they are visible in about 30 years. Well, children don't care about diabetes. Actually, the child that cares about diabetes, well, we're worried about them. So make it fun. That makes it also, well, possible to contain the behavior and create a habit on it. As long as it's not fun, as it's not easy, we will not easily succeed in changing those healthy, those lifestyle behaviors into healthy ones. So I totally agree with you.